Tuberculosis. If the TB patients are not following the drug regimen correctly, then there are chances that multiple TB patients will be affected. And subsequently, basically the TB drug treatment is around 6 months or so. If it's not if they are not following the drug regimen, then there are chances that multi-drug resistant tuberculosis occurs. Multi-drug tuberculosis again is very quite infectious, and there are always chances that it spreads if the drug regimen is not followed correctly. It leads to another condition or leads to the next stage called as extensive drug resistant tuberculosis. This is XTR-TB. For the incidence of multi-drug resistant TB and the extreme drug resistant TB is increasing, especially in the developing countries like India. And this is a pictorial representation where you can just see this Mycobacterium tuberculosis bacteria, how it goes and affects the lungs. It basically TB not only affects the lungs, it also affects other parts of the body. It also affects kidney and other parts as such. The drug basically for this bacteria was founded somewhere 40, 50 years before. There was a vaccine, BCG vaccine, but the BCG vaccine are not so effective. Not, I would not say, we cannot say it is 100% because there are many new cases which is arising nowadays, especially in the developing countries. There is a need basically for a vaccine with a modified vaccine basically, because the strain are I mean, the new strains have been found, and the laboratories or the pharmaceutical companies research they have to give this area as a high priority in finding a new molecule um, with a modified vaccine, which is the need of the hour. In addition to the drugs, I mean, even though many pharmaceutical company research is very aggressive on finding a new drug for TB, it has to be considered as high priority. The next important factor is the compliance. The medication for TB is 3 to 4 drugs in a day, and it should be followed. I mean, very very seriously, because there are a lot of chances for resistant cases. There are some agents in India who has a center who has a database who are registering patients who are on TB. They have a compliance terminal, they have a, finger terminal, they have a fingerprint this thing, and USB port where all the data can be registered, and it can be SMSed to the patient in case if they miss a dose, and they'll get an SMS after the registration that the dose has been missed. So subsequently, and they also have a system on verifying the database. There is a counselor who sends the SMS, and at times they directly go to the patient's house and educate them and meets them and explains them the seriousness of missing a dose, which is to be done in many cities, and this is one of the important thing which has to be followed.